I think he developed a reactive airway disease problem, which we can explain later, which I can explain later. He had a certain degree of hypersensitivity pneumonitis. He developed some respiratory upper airway irritation resulting in some mild laryngitis. He had some dermatitis, which is inflammation of the skin. And lastly, he developed cataracts secondary to the steroid use he took for his respiratory problems. Yes, I think that's actually his main problem. That's his ongoing, persistent, most debilitating and most expensive problem he has is reactive airway disease. Reactive airway disease is a condition where one can be exposed to a chemical or a substance of some sort that in certain people they have a reaction to it, and the reaction is out of proportion necessarily to the amount of exposure. In reactive airway disease, we know from the literature, from patients that we've seen, from studies that have been done, that even a small exposure to certain kinds of chemicals leads an individual to have a very reactive response, where they'll develop inflammation in the lungs, bronchospasm, where the muscles contract. There'll be fluid that infiltrates into the membrane surrounding the lung tissue, and it leads to a persistent problem. And not only that, we've known from many people that have had this problem that even a one-time exposure can lead to lifetime consequences. And even though you're not continually exposed to that, like you would in an allergic situation, you nonetheless have a permanent reaction to this, and you nonetheless will have a permanent need to be treated for this. So this is a guy, in my opinion, that had a little bit of problem in 2002, never saw a doctor for that again, never had treatment again, never went to the hospital, had pulmonary functions as far as we can tell since then, and then suddenly has an exposure and now has persistent problems ever since then. This is reactive airway disease. Well, I think now, just by definition, it's been 2 years since, and he needs to take the medication, and he still has issues that only can be addressed by taking the medication. So yes, it's chronic and it's permanent. Well, if you annualize the cost of the medications, the hospital visits, the pulmonary function tests, the chest X-rays, the CT scans, the potential and expected hospitalizations, including all the costs associated with that hospitalization, and just looking at the medical side, ignoring any lost work time, I think it would not be unreasonable to expect it to be around $20,000 a year. And if you multiply that expected life expectancy in a 50-year-old man, which will be another 25 years, you're talking about almost $500,000. But had he used the protective barriers, the gloves and respiration equipment, protective personal equipment, more likely than not, he would not have experienced this. He would have not had the exposure, and things would have been better, or never had occurred, actually.